I am Terry Jordan, and I am Cody Jordan's mom. I get to introduce Kristen today for our webinar. Just to give a little history real quick, we started music therapy with Cody when he was in kindergarten at school, and then he continued that through 9th grade at school, but we also started private therapy right about the same time, and it has really helped Cody develop speech and other key learning points that are associated to intellectual and developmental disabilities. But introducing Kristen, I know that every one of you got to see the online part about where she went to school and everything, but I thought this was an interesting fact, which is Kristen plays 5 different music instruments. The kids get to enjoy ukulele with her. I know that Cody has enjoyed a variety of instruments whenever the music therapy has come and been in action. I think this is an important note for parents to understand, is Kristen has had to put in 1,040 hours of unpaid internship in order to get her therapist degree. And if you average that out at 40 hours a week, she's put in at least 26 weeks, but I'm having a feeling it was a lot more than 26 to be able to make this possible. And I want her to take it over and talk about the age range of children that she has worked with and what she has done. So thank you, Jennifer.
Right. So yeah, like Terry was saying, I had to complete 1,040 hours of a clinical internship before I could even get my board certification and be considered completed for my degree. I work personally with, I think the youngest person I see is 5, maybe 4, and the oldest person I've seen has been well into their 80s. So I mostly work with kids and teenagers and some adults that have developmental and intellectual disabilities, such as autism, cerebral palsy, stuff like that. And then I also work with a group that is an intergenerational group. So it's young adults that have developmental disabilities and older adults that have dementia and Alzheimer's. So I have a little bit of experience working with that population as well. So we'll get into our Music Therapy 101. So I'll just kind of give you guys a brief overview of what music therapy is, what we can address with music therapy, how it works, how you can receive services. And then I'll give you guys a couple examples of things that we might do towards the end, things we might do in a typical music therapy session. And Cody has so graciously agreed to help us out with that, so you guys can see a live demonstration of a music therapy intervention. So, what is music therapy? That's the pretty big question that a lot of us get. Just to quote the American Music Therapy Association, it's the clinical and evidence-based use of music interventions. We use that to accomplish individualized goals within a therapeutic relationship by a credentialed professional who's completed an approved music therapy program. Basically, what that means is we take music as a modality, a therapeutic modality, and we work on non-musical goals. So a goal that you would be wanting to accomplish with your child that they might work on with a speech therapist or a physical therapist or an occupational therapist or just in school, just goals in general. We can take those goals and we can add music, or we use music to help accomplish said goals. Why does it work? That's another big question we get. So for starters, music is a huge novelty. You know, you hear it in everyday life, but getting that hands-on interaction with music is just a whole new thing for a lot of people, you know, unless you're in band or something like that. You know, you get music class maybe once a week in elementary school. If you join band in middle school and high school, you're getting that, but it's not a thing that everybody has access to. So it's something that's very unique, and you don't get to do it all the time. You don't get to do it every day. It's not a super common thing. Music can actually access neural pathways that are not always easily reached by traditional therapies, meaning there are pathways in our brain that are not typically activated or targeted using like speech therapy or occupational therapy or anything like that. Or they might be targeted, but they're not responding super strong. Now, when you throw music in the mix, it's actually bringing those pathways to life more so than traditional language therapies. is a study out there that they're thinking they've actually found a neural pathway that they didn't know existed before that is only accessed by music. So it's just giving so many more routes into the brain to help these different things activate and help just really boost progress that you may not typically see in a traditional therapy. And that's not discrediting those traditional therapies. Music therapists a lot of times will co-treat with occupational therapists and speech therapists and physical therapists, because you throw their training in as their modalities on top of the music, then you're just really asking for huge leaps and bounds. And it's really exciting to see co-treating happening. And then when you think about it, music is really just a part of who we are, especially rhythm, like drumming and stuff like that. We have our heartbeat. It's a steady pace. We have our breath rate. You're typically breathing at a standard rate, whether you're in pain. If you're in pain, you might be breathing a little more shallow and a little quicker. If you're relaxed, you're going to breathe slower and deeper. So, and then our gait, our natural walking pace is a very rhythmic thing. So when you really think about it, music is very ingrained into just our natural bodies as a whole. So who can receive music therapy services? Pretty much anybody can receive services. We have therapists that work with NICU babies, so premature babies that are in the neonatal intensive care unit. Students that have an IEP in the school system. I work personally, I contract partially with St. Louis Public School District, along with a couple other therapists that work for Midwest Music Therapy Services. So we go in and we address IEP, Individualized Education Plan goals with music therapy. Individuals who have suffered traumatic brain injuries, we work with them. Memory care, such as Alzheimer's and dementia. Hospice, making a smooth transition into that next chapter for both the families and the individual that is on hospice care. Individuals that have developmental and intellectual disorders, going into their homes and helping them achieve goals that may not be addressed in school for them because it's not an educational goal. And there's so many more people that can receive services, just pretty much anywhere across the board. Music therapists can work with, trauma survivors, military veterans, eating disorders, anything like that you can think of. Pretty much anybody can receive music therapy services if they want. And then when we get into who can receive, we also want to talk about what goals might be addressed through music therapy. So we focus a lot on speech skills. So, enunciating those words, speaking more clearly, using the appropriate volume. We might get somebody who talks really quietly all the time or whispers, or maybe on the opposite end of that spectrum, they're yelling all the time. And then even getting some vocalizations. I personally work with some individuals who are nonverbal, and we work on just getting any kind of vocalization out. We work on getting some sounds. I have one individual I work with that we have gotten her from just being able to say ah, and now she can say ooh, and we're working on e, and she can make some consonant sounds. So just any kind of vocalization, really. We also work on those communication skills. So having a conversation, that's something that not a lot of people realize is a goal that can or should be worked on. We want to be able to make it to where they can converse with an individual, whether they're doing it verbally or non-verbally. So we can address that, making requests, expressing their feelings, how they're feeling at that moment. And then using short eye contact to let a listener or speaker know that you are listening and you are prepared and you are there. We don't necessarily want to encourage that maintained eye contact because it's not always comfortable for everybody, but just that quick, I'm here, I'm listening, I'm watching you, I know you have my attention. And then they can look away as long as somebody knows that they're watching. We work on cognitive skills. So sequencing, following directions, reading, writing. Those are a lot of those educational goals that you might see in the school systems. And then behavioral skills is a really big one we can address. So appropriate interactions. We don't want kids to go around and when they get upset to scream or hit or anything that might be considered an inappropriate action for societal standards. We work on relaxation, bringing that self-calming in, So if maybe somebody's really worked up about something, helping them realize, let's take some deep breaths. Let's pick a song that's very soothing. Let's just bring those energy levels down. And then that also goes into the self-calming as well, using songs to teach techniques that they can use to calm themselves down. So teaching them how to give themselves a big hug, squeezing their hands, squeezing their head, whatever they might need to do to bring themselves down, asking an adult for help. And then also working on appropriate peer interaction. So being able to go to school and interact with their peers in an appropriate manner. And then we also address physical skills in music therapy. So fine motor, gross motor, and stretching. So those fine motor skills, can they grasp a drumstick? Or how can we fix this drumstick so that they can grasp it and slowly make it to where they might be able to grasp it a little better? Using fingers to play the drums. Sometimes we isolate those fingers. I do adaptive piano lessons with some of my students. So really just working on isolating fingers one at a time, working on those fine motor skills. And then the gross motor skills. Do they have the motor skills that they can pick that drumstick up? Okay, they've got it gripped in their hand, but can they pick it up and swing it forward and hit a drum hard enough to produce a sound? And then stretching, just really getting those muscles loose, those joints loose, getting those bodies really moving, even if they're only making small movements like this instead of all the way out or something. Just really working on addressing those different types of goals. So those are some pretty common things that you would see in the setting that I personally work in being addressed through music therapy. And there's so many other things that can be addressed. It's just a matter of you sitting down with your therapist once you determine if you're going to be receiving music therapy services to decide what goals you want to work on and what you want to be addressed. So that leads into our next slide of how can you receive music therapy? So the first thing I would say is just reach out. I'm going to be including some information at the end of this PowerPoint on the two main websites on how to find a certified music therapist to work with in your area that, and it tells you what populations they primarily work with, where they're located, and it gives you contact information to be able to reach out and get those things set up. And then the next step, once you've reached out and you found a therapist, you want to get assessed. You want to make sure that music therapy is going to be appropriate for your child. As great as music therapy is and as how widely it can be used, there are some people that just, it doesn't necessarily work for the goals that you're trying to accomplish, as with any therapy. So you really want to get somebody in there to determine, is music therapy going to be an appropriate therapy and an appropriate modality to really help your child progress? Or is it just going to be something that might be looked at as just a fun little music lesson that you could probably get from somebody who's not a therapist, and they're still going to be getting that fun stuff. They're just not necessarily going to be focusing on therapeutic goals. So in an assessment, what we're looking for is we take a goal that you might want to work on. We will address that goal using no music whatsoever. We want to see how your child does in a non-musical setting, and we'll take some data on that, and then we'll come back and we will address the exact same goal, but we'll use a musical intervention. So we'll take data for that, and then we'll compare the data. If there's been a significant improvement on how they did on that goal when music was introduced, then they're going to qualify for those music therapy services. If it's the same or even a little bit less, then unfortunately, they're probably not going to respond as well as one would hope for music therapy. And that's okay. There are several therapy modalities out there that work really well for other people. And then if music therapy does prove to be that beneficial for your child, then you're going to determine what goals are going to be addressed with your therapist. Do you want them to work on their conversation skills? Do you want them to work on their reading skills? Do you want them to work on vocalizing at all? Do you want them to work on their enunciation? Anything like that. You sit down with your therapist and you make a plan of action. What are we going to address? And then you can always reassess later on down the road and add new goals and take goals away. I know with Terry and Cody, we're constantly sitting down and saying, okay, well, he needs to work on this now. So let's kind of throw this in. Or during my demonstration, Cody and I work on directions a lot. And just the other day, we decided he's been doing so good with his normal direction song that we came up with a new one, and he's doing a totally different type of directions now. So, it's just a matter of seeing how your child's progressing and what you want to accomplish for them, what you want them to be able to accomplish. So let's see, I'm going to stop the share here. I've got a quick little video clip. So for communication, we don't always think of communication in terms of speaking necessarily. A lot of kids, especially our nonverbal kiddos out there, use iPads and tablets and other communication devices to express their wants and their needs and to converse with us. And so this video is just an example of how a child with a tablet is practicing his communication skills with this therapist. It's a quiet video, so it's kind of hard to hear what he's singing. So after he's done, after we're done with the video clip, I'll kind of talk you guys through what was happening.
More? Yes, all right. Let's play those shapers today. I say yes, all right. Yes, yes. I say yes, yes. I say yes. I say yes. Let's try it again. Yes. Yes.
Okay. So, as you could see in that video, I don't know how well you could hear. He's starting by singing, yes, yes, I can say yes, 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 I can say yes, 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 I can say yes, 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 yes. And then he says, now it's time to stop. And he'll stop playing the shakers. And what he's doing is he's allowing the child to take a moment and realize, oh, we're not playing anymore. And then he says, do you want to do more? And he uses a gestural cue by looking at that iPad so that the child knows, oh, okay, so I need to decide if I want more. And then he can determine if he wants more or not. So as you saw in the video, he hit yes. So they continued to play the shakers some more. There are instances where the child might get too excited and they'll reach out and without looking and they'll touch no. As you saw, the therapist was really having to remind his student, you know, look at the iPad, look where you're touching. In cases where they just really won't look and they hit no, we would put the shakers down and we would wait and say, okay, we're done, and give the child a moment to process and decide, oh, okay, never mind, I do want more, and say yes, or they can say no again, and that's how we take that as, okay, we are done, and we put the shakers away and we move on. So our next demonstration Cody's gonna help me out with, we're gonna show you guys our direction song that we've been working on. And this is we use it for sequencing and just listening and remembering steps and remembering the directions he's given. So in this instance, this is our new direction song. I'll sing a song with him and I'm going to give him 4 words that he has to remember, and then he has to write those words down. So Cody, if you are ready. I think he's muted. Cody, can you hear me?
Yeah.
Okay. Are you ready for our directions?
Yes.
Okay. So what color are you going to use?
Orange.
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 There you go. All right. You ready?
Yes.
Are we doing 3 words today or 4 words?
4 words.
4 words. All right. A, B, C. It's easy as 1, 2, 3. As simple as do, re, mi. A, B, C. 1, 2, 3. Cody, listen to me. We're gonna write the words school, desk, marker, and eraser. Do you need to hear those words again?
No.
Look at me. Do you need to hear the words again?
No.
Okay. So we write the words. What's first?
What word are you writing first?
School.
Okay, write the word school.
Good.
S. S. H. C.
Almost.
H.
Mhm.
O. O.
Ooh.
L.
Mhm.
Good. And then what word is next? So we had
Desk.
school,
Desk.
desk. Good.
E. A.
Well, not E.
E.
Good, Cody.
A.
Desk.
S. D. K.
There you go. Good, Cody. Desk.
Eraser.
Eraser. Good.
E. E.
Mm-hmm.
Cheese.
Ear.
R. E.
Sound it out. So say it nice and slow. Ear.
A. E.
Not quite. Ear.
A.
Good.
R. S. R.
There's one letter before that R. What's that letter?
E.
There you go. E-R. And then, so we had school, desk, eraser, and
Marker.
marker. Good, Cody.
M. A. C.
Mar.
R. R. C. R.
Mark.
C. K.
Just K. Marker.
R.
Is it just R? Or is it? There's one letter before that R. What is it?
E. R.
E-R. Good, Cody. All right. Nice job. So we had school, desk, eraser, and marker. Very nice, Cody. So with that direction song, what we were looking for is, can he remember the words that I told him without any prompting? And he did really good with that. And then can he write them down? And eventually what we're going to work up to is, can he remember and write them down in order, right, Cody?
Yeah.
We're going to work on writing those words down in the order that I say them. And that's really working on that memory and really getting him that short-term memory, getting him to remember, okay, so this was the order that these words were told to me, and these were the specific words. And that's going to really help transfer over into his job and his school and everything like that, and helping him follow those multi-step directions without having to be told step by step what to do. So that was really awesome, Cody. We're going to do one more, okay?
Okay.
Okay, so our next activity we're going to work on is, this is Cody and I's goodbye song every day. We always end with a goodbye song, and we always work on what we take our time, we speak nice, and we slow and clear, and we get all of the
Sounds.
letters and
Sounds.
sounds. Good, and we use our full sentences, right?
Yeah.
So with our goodbye song, we say a couple phrases together, and Cody really work hard on taking his time and making sure he's enunciating and saying those words nice and clear and getting all of our letters. So Cody, what do we say during our goodbye song? So we say, see you later. Oh, you skipped part of it. We say, see you later who? See you later.
Alligator.
Alligator. Try one more time.
Alligator.
There we go. And then we say after
One crocodile.
crocodile. All right. So we're just going to do that part, okay?
Okay.
I'll see you later, alligator.
Alligator.
Good. After a while, crocodile.
After crocodile.
Try that one more time.
Crocodile.
There we go. I'll see you later, alligator.
Later, I just take picture.
Good. After a while, crocodile.
After a while, crocodile.
Good job. I'll see you again real soon. And we'll have a real good time. Goodbye. Goodbye. Goodbye, Cody. And then we say what? We use that
Bye,
sentence.
Kristen.
And you say bye, Kristen. Nice job, Cody. Thank you for helping me out with that, bud.
Yeah.
I appreciate it. All right, so to go back into our slides here. So those were just some demonstrations of things that can be addressed and how they can be addressed with music therapy. So just to kind of end things out, we have two main websites. We have the American Music Therapy Association website, which is musictherapy.org. And it's got so much information on there. It'll talk about more in depth of, what is music therapy? Who can we work with? You can find board certified therapists in your area through that website. You can find resources. There's all kinds of wonderful information all over that website for you to have access to. And then the certification board for music therapists is great because it also talks about what music therapy is, but it really helps you track down those board certified music therapists. So anytime you want to get your board certification, which to be a music therapist is required, there are people out there who do not have their board certification at the moment. We are working on trying to get that a nationwide thing that is a mandatory thing to happen. So cbmt.org is going to show you an entire list of all the board certified music therapists in the entire continental United States. And then they could also, I believe they would help direct you to where you could find music therapists in other countries as well, if need be, because each country is a little different on their requirements for what you have to know to be a music therapist. With musictherapy.org, you're going to find some great board certified therapists on there, but it's only if they are registered as members of the American Music Therapy Association. So, and not all music therapists are members of that association. So, and that is the end of my slides today. So I think Terry was going to talk a little bit about music therapy with Cody. I think that was the plan, right?
Well, what we've done with Cody is worked on several different goals since kindergarten going forward. Those of you who know my story know that Cody did not even start talking a few words at age 8, but like I love you didn't happen till age 9. And so when the first therapist introduced me to music therapy was in kindergarten, and he came in and he said, we got to do music therapy for your child. And of course, my child was not speaking, and I'm thinking, well, he's not singing, so what does this mean? And the therapist literally said to me, well, watch this. And what we found out is how much knowledge that Cody was taking in but couldn't get back out. So for example was the number 3. And so he handed the guitar to Cody, and Cody could strum 3 times. He asked Cody about some simple letters, and if he got the right letter, then he would strum the guitar as a reinforcement piece. And the more we were seeing take place, the more growth that started taking place. Then over the time we have had his address, his phone number, how to count by 5s, how to count by 10s, how to understand coins, and then the conversation songs to be able to have social conversations with different people and ask some more than just general questions, to not repeat questions, to understand how to make that different, to the social skill of learning how to not interrupt. And that one works really well, which she did from the song We Will Rock You. And I can just make the signs from it, and he will pause and go, wait. And that's all I need him to do to be able to continue my conversation with someone, and then be able to join in with him instead of just always having it as an interruption. So those are just a few goals. I know we've had many goals over time, but he loves music therapy. It is one of his important part of the times of the day to get down and be able to be with Kristen and do different instruments. And I can't, the guitar, he's over here in the background telling me which instruments. And I can't remember if it was with you, Kristen, or the other therapist, that he loved playing the cabasa for a long time. And that was his favorite instrument to get out at the end of the session to play. And different ones came along, and different types of drums that you've brought over to the house just to break it up and see what else might be happening. It's just neat interaction. All right, Jennifer. Go ahead.
Sorry. One thing I had forgotten to add in, that as you were talking about it, the ultimate goal with music therapy is to get them to a point where we can wean them off of having to have the music constantly there, and they can address those goals without the music involved. So with Cody, with his phone number and address, he can now say those just completely prompted without music, and he can tell us his phone number and address now. So that's really the ultimate goal with music therapy.
And I will tell on him here for a moment. So in his 9th grade class, the teacher took me aside and said, we have a big concern. Cody does not know his address. And I'm like, he's rattling it off here in the background for me. And I said, oh, he knows his address. And he's like, no, Mrs. Jordan, he doesn't. So I just started humming the song that Kristen had started using with him, that Cody has an address. And he turned around and he's like, stop it, Mom. And I said, and it's put in a song. And he's like, fine. And he rattled off the address to the teacher. And the teacher just sat there and said, I got suckered. And I'm like, uh-huh. And I said, and Cody has a phone number. He's like, stop it. And I'm like, and it's in the song. And he rattled off the phone numbers. And the teacher was just jaw dropped as long as it could be. And I'm like, the music therapy works. He had the information. Now he was being a teenager, showing he could withhold the information. But that part was also kind of cool, but don't tell him, just because it was part of growing up. But it was also neat that the information was there and he was able to bring it forward with it. All right, Jennifer, did we cover every topic that we talked about?
We did. I can't thank you both enough for your time and the thoughtfulness that went into this presentation. As Kristen and I were talking earlier, I think when families are first diagnosed, first they're hearing a diagnosis of Okur-Chung neurodevelopmental syndrome, which is a mouthful. And then, sometimes the geneticist or neurologist is saying, so now you need speech therapy and OT and maybe ABA and early intervention and all these words. It's as if you're in a cartoon and there's bubbles above your head with these words that you may or may not have heard of before. And so I think this is such a fantastic resource to know that there's not just speech therapy or OT, that there are other therapies out there that you can see whether or not they work for your family, because the goal here is for us to give our children exposure and the most opportunity possible. And I think also the more services and intervention that they have, I think they'll be able to live their most kind of vital and vibrant, worthwhile lives. And that's what our goal is. So I can't thank you enough for bringing this to life for our first parent and patient education webinar about Music Therapy 101. Thank you so much for your time.